to reflect on the challenge faced our community, particularly on the hard lockdown. It's all been in the mind of everyone, and everyone has been thinking about this. So we said, let's have the people who've been there and been participating and making the bridge between the system and the community. And they put themselves in front line to help the community, the residents of the 9 towers in North Melbourne and Flemington. That's very historical for these people that have done so much, putting their life and their family at risk. I commend them for that, and I want them to participate with us because that's unique experience, which will never get it. And it is an opportunity for them also to tell us the story as the first-hand experience. I'd like to acknowledge the traditional owners of the land first, on which we are, the Aborigine, the Wurundjeri people, their elders past and present in Victoria. And that's first and foremost. Always we acknowledge them because they welcomed us in a very timely manner for us, particularly Africans, and myself and many others as refugees came here in this country and had this opportunity. So we are very grateful for this opportunity, and we are part and parcel of the society that would like to build together with everyone, particularly the reconciliation of Aborigines is in the front line in our way of looking to the future, because them being part of us and we being part of them in the journey will be a great opportunity. Coming to the introduction of all our speakers, I'd like to introduce first the 2 council standing members of our speakers today. Ring Mayer, standing for the Sunshine. And Ring was known for most of the dedication that has taken the community in a front line, challenging with media and with many other services, talking about the challenge young people facing in Sunshine. And I commend him now to stand in the Brimbank Council to put the community issue on the table of the council. And this is, I tell, it's not an easy to stand in election, particularly in this climate of COVID, where everyone is in a situation that we don't know where we go, we don't know what the situation is. But such dedication is an exemplary for young generation in the future. The same way Hamdi from Carlton has taken this opportunity, and I'd like to commend Hamdi. I've known Hamdi for many years, and he has dedicated as a Carlton man in the housing, has contributed in many projects, particularly helping families and men with the council, supporting with opportunities, access for children, has been doing that. And now for him to stand in a council, Melbourne City Council election, it's something that makes the community proud. So to have our community members standing this time in all the councils, it is great, particularly to see such dedicated individuals like Hamdi, Ring, and many others is a great opportunity. Both Ring and Hamdi has played a significant role in the COVID challenge of the 9 towers, or the Carlton and Fitzroy, the same way that the COVID affected and the lockdown has been. Most members of the community were struggling to understand what COVID is and why they were locked, why this has happened to their family, and why the children being lack access to education has been a crisis for them, despite the rest of us were not locked at the time. So this gentleman has done so much work in helping that bridge. But also, Yasin was one of the committed leaders in the first instance of that lockdown, the 9 lockdown. The first day was there because that commitment has shown the community inside that he was a bridge communicating between the community living in those lockdown and the administration from the Flemington Community Center. That has brought a better understanding within a short time, because those people, the commitment, and those people engaging the community and the residents has made that tension ease. Yadata was also of the same caliber, came to that journey. I've known both Yasin and Yadata for nearly 20 years. They never stopped contributing. They never stopped participating in doing this. But the most highlighting journey that I have seen for being selfless, these leaders, and tonight being with us, are their commitment, putting their life at risk, their family, to stand and help those residents in the hard lockdown, are these people. So I'm really proud to welcome all of them to this night and for them to highlight. But particularly also, I have a special facilitator here, my good friend and my mentee and everything, ID, has always been inspiring, and she is the energy behind all these kickoffs. She has taken this from day one. In fact, I have seen her committing to this journey and many others, particularly in the western suburb. AD has been a role model for many young girls and young boys. And she has worked in Brimbank area, and she's working in the Melton Secondary School. Her dedication, in fact, one of the best things that she had last year was the Churchill Scholarship. She brought language, she brought experience, she brought inside knowledge of many other experiences around the world, and sharing it with young people now in Brimbank and the surrounding. But she never stopped there. She has been challenging me every day with many issues that she takes at heart, particularly the challenge that our community are facing. The Black life was one of the front line of her issues, but without so much now, I would like her, there's so much I can say about her because I have seen her working and doing that. So I will hand it back. Do we have the fifth speaker? Is that Hamdi Yasin and
Yes, everyone is
Yadata?
here. Everyone
Is
is here.
Al-Hadi here?
Al-Hadi is there? Well, welcome Al-Hadi. Al-Hadi, well, look, Al-Hadi has got a special journey that I've joined him. Since 2004-5, Al-Hadi has been doing home support schooling for young kids in the building in Flemington, and has had dedicated office supporting families in the Flemington area, particularly as a father and as a community leader, has saved a lot of families, particularly partnering with many service organizations. And Al-Hadi is well known in the Sudanese community, has done so much here and in Sudan, and he's well known for his dedication supporting families and children in Flemington. So would I all of you welcome you and your dedication. And Al-Hadi was one of the people in the lock, but with that lock, he was not stopped. He participated as well from inside and outside. So I welcome everyone. And Adi, the stage is yours. Thank you.
Thank you so much for those introductions, Dr. Barhan, more than kind. We're going to get straight into it because we don't have that much time. And I'm sure all of these professionals have a lot to say about the lockdowns and the impacts it's had on the community. So I'll start off with the first question, which is, what's the impact of the pandemic on immigrants, migrants, refugees in Victoria? I want to throw this to Yasin. Would you like to start us off? You're on mute.
Yeah, thank you everyone, and thank you the guests for giving me this opportunity to say exactly what's happening at that time. I've been working with the department in that area for nearly 3 weeks since the start of the lockdown until about finished Flemington and North Melbourne, in all relays between the residents and the Department of Justice. My name is Yasin. I'm one of the African community leaders in that area, which is my community called the Jaberti community. So we've been working in Flemington area nearly for about now for about 10, 15 years. We do homework clubs, sport activity with all your data in all the other group here in Al Hadi. And yeah, after all these services, we got very bond and good relation between the residents and ourselves, because that's a sport activity we do. Yours is coming up. The one is 9 years old. After 3, 4 years, they become 13, 14. And then the one that's 13, 14, they become teenagers. They play a game, sport. We got very good life to that area. At the same time, we do like festival, big festival for people to have gathered together and all this. So, and one day, which is the 4th of July, this is the panic day. No one in Flemington, in North Melbourne, he won't remember that day. Why? All of the sudden, about 400 or 500 police men with fully equipped come, bam, down, same like they come from the sky, come land to that area. Sorry, I will say it. Maybe someone may don't like the way I will say it, but this is the fact. This is my experience. This is my documentation, my community, and the history. So, bam, about 300, 400, 500 police come down. Imagine from level 10, 15, when you look down, all the area police cars. What do you imagine? What's happening all of a sudden? So everyone straight away, he jumped to the telephone, he called his leader, which is, they call me, they call Yadata, they call the one of Somali leader, this Hamdi, they call Hamdi, they call Al-Hadi. Al-Hadi himself, he was locked up there. So what's happening? We don't know what's happening. That was about 5 o'clock or between 5 and 6. So what are we gonna do? We don't know. I don't know, Pasu, if Pasu here, straight away, he's from police liaison. We call Pasu straight away. Pasu, what's happening? The resident is calling me. There is some war going on in Flemington in North Melbourne. Can you please look? And Pasu himself, he doesn't have a good idea at that time. But later the police tell them, we don't know, not from our area, which is normally we work with the police in Flemington, our office in Flemington. So with that police, every single thing happening in that area, the police is straight away, they communicate with us. We communicate with them, and then we tell to the people what's happening. And then we solve any problem arise in that area. That day, no one will give an answer. And then I told them from my home, the residents of my community, I'm coming in my way. It takes me about 20 minutes to get there. And then when I come through Race Course Road, Channel 9, Channel 10, no one can let me get in. This is my area. And then I went to the Silent Alexander Road. No one will let me in. And then I went to Holland Court. No one will let me in. So what I can do? The time going 7, 8 o'clock, straight away we call again to the residents. No one will give an answer. And then I get to the one police through Mount Alexander. I told them, please, can you tell me what's happened? What's in there? I'm community leader here. My office is there. And I know all those people living here. I know a lot of leaders living here. I will help you. He tell me what's happening. And then he told me, look, those buildings, not only this one, about 9 building towers, 9 towers being infected with COVID-19. I told them, infect all of them? He told me, I don't know, that was the end. So now we block, no one can get in, no one can get out. This is, I call it the panicking attack day. So I stayed there till about 9 o'clock p.m. or 10 o'clock. And then I called them, there is nothing happening. I spoke to the police. They told me, so okay, something about COVID-19 happening. Maybe they will do tests for you guys, but something else, I don't know. And then we called the police in Flemington. And the police tell us, the one, those always we talk with them, we communicate with them. They tell us, look, guys, we ourselves, we don't know. They took from us, the police, they normally do patrolling in the area. They took them.
Thank you.
You listen to me?
Yes, yes. Continue on. We'll just need to move on so we can get ahead of time. But yeah.
Yeah, I will talk to you about panicking day, and then after my friends may talk. But this is the first day was happening. So the police told me, even the police from us, they took them from us. They didn't tell us why, but they took them from patrolling, and then they are waiting there. That's the first day happened. And then everyone is panicking. Everyone, the old lady thinking about the medicine, how they're gonna get medicine. I know two people with they got a wedding to go. Not only that, he is the best man at the wedding. He depend everything on him. He break this guy. He can't go out with his clothes ready, some clothes for the groom. So all this panicking happened the first day. You want to continue me? I will continue for next day. The second.
Thank you so much for that. Ring Mayar, what was your experience on the hard lockdowns and the impacts of that on the migrant and refugee communities? You're on mute. Unmute yourself, Ring.
Thank you. I always forget, sorry. Thank you very much, Adi, and I commend you for the great work you've been doing with your colleagues there. And I would like to thank the Africause, particularly Dr. Burhan. He was so generous in his introduction, but he is the pioneer of the great work that many leaders have done, myself and my colleagues, whom have just, their names have just been mentioned. Just because of the time, I'm quite conscious about it. My experience, the work that most of the leaders have done in those towers, it is an enormous job in a sense that is quite daunting, it's quite tiring, and it's time consuming. And that's have been really great. But I know that we were also supported by great people that ran us. And I would like to acknowledge somebody who has been a great support of our African communities and cult communities and other communities, unreal exception. Dr. Irene, she's with us, and she's been guiding us. She's been working with us all along. And I would like to welcome her on this forum as well. And many other colleagues from other departments and other organizations. It's good to see many faces that I've come across. What I would like to say, the impact is quite enormous in a sense that until now we can't make an absolute assessment about the impact the COVID-19 have really inflicted upon people who are living in those towers, as well as Victoria as a whole. That's without drilling down to it too much. The mental health now is one of the bigger issues that have been identified even by the federal government and the state government. Young people have been impacted in many different ways you might think of, whether continuing their schooling, socializing, or even those who are 18 and in their early 20s. Their lives has been turned upside down in the sense that they can't get a job now, they can't continue with their universities. And also our seniors, majority of them are living by themselves. A lot of people have been rendered homeless in the sense that actually now, even if you do have your own money, you can't expect a house and move in because of the COVID-19 restrictions. And I'm not saying all these restrictions, there's anything wrong. We need to maintain social distancing. We need to carry on the chief executive medical officer advice so we can all stay safe. And from this platform, I would like to really express my sincere condolences to those families whom have lost their lives in many different fronts. Our community, particularly I'm a South Sudanese community leader, as I was introduced, we're not immune from this. We were hit really hard, and it's the same. Our community is not exception, or even the COVID-19 impact is not exception to our community. Other communities have been really, really impacted so hard. And until now, we don't know how the future would look like and how we come out of this. We're still in it, and we still have to work hard until this COVID-19 is eradicated for good and for all. And then we can make an assessment later on about what we could do for our lives.
Thank you so much, Ring. And that takes me to the next question. I know most of those apartments are 2 or 3 bedrooms with large families living in them. So how has the pandemic or the hard lockdowns affected familial relationships in terms of family and domestic violence? Yedata, do you want to answer that one? Can you hear us?
Yes, I can hear you now. Yeah, it's a good question. Thank you. It's really important to know all information, because when the first thing happened, all community, all family, they become very stressful, they become more mental issue, you know. That's why when the first time doctor, he sent message to me, and then straight away I went to Flemington, and then we meet, you know, the person. And then next day, the beef, she's coming, Victoria Multicultural Commissioner. we try to communicate even with the police. The police only the first time they know how to ignore, how to push back the people. After that, we try to discuss all the community leaders, me, Yasin, Farah, Ring, because it's really important. The community leader come discuss about the issue. Some people, the family that calling us that try to, the jump from the high rise. That's why, as a community leader, the call us how to solve that issue. Straight away, we can't do anything. We have to call them, cool down to explain as a religion, as the cultural system, because this system very confusing all community member. And then because a couple of days, because it started the family violence with the family, even the father no communicate, very hard to communicate between the family, father and the kids, the wife, really very hard to help them, because everyone, when they become more stressful, they want to run out, because very hard to get out. Too many people are crying, more stress, more mental issue. Some people that not staying home without the medication have the health problem, because they wait like 2-3 days, very hard to get the medication until we discuss with the police, everything with the department, sit down, discussing, sharing information, because without sharing information, sit down, discuss with the department, very hard to solve the issue. And then after that, one by one, when we know the information, we have to ask the police. We try to knock the door, find what they need. Even some people that very hard to eat the food to bring from outside, because they say because a lot of people that say it's haram. We don't want to eat these things. That's why I find someone some people not eating for 8 hours. That until we discuss everything. This food is halal. We have to experience as a community leader, because when the family because this thing happen straight away, because they don't have the shopping to bring it from outside. We have to one by one to find something. We have to send to them we have to ask the police. It's really important to sharing information with the department, with the police, in the community leader, all the department health. It's really because to sharing is still, because when there is everything the opening, we're gonna have the big problem. Young mental issue, family violence is still the problem. We try to discuss holding because we don't want to destroy the family. As a community leader, we have to call them. We have to call the imam. We have to call the elderly. We organize a Zooming how to solve the issue. It's gonna be a big problem to solve the family violence. When the young, like 15, 16, they don't want to stay with inside the violence. When the husband, wife becomes a problem about the issue of the mental, very hard to handle whole the family. Still, as a cultural system, we try to organize the solving one by one. Is a good thing, because when we try to bring like imam and then the community leader, the elderly, how to solve the problem. Because the problem when the young kid is born here, they follow the system, very hard to listen the cultural background. We try to still, as a community leader, no one listen to us, because we try to how we know how to manage the cultural background, and then we have to merge with the Australian system, the young generation growing up here, the mother, because the young person, he said, I'm living between the two governments, he said, because when with the families different government, with the Australian system different policy. That's why we try to merge in the communication, the important information. Really, still we need. They're gonna take long to solve the whole thing, to bring together on the table to solve for community member.
Thank you, Yadata. Yeah, that generational gap is a huge barrier, and obviously being cooped up does raise some frustrations, which can possibly lead to family violence and more domestic violence. Hamdi, would you like to add anything to how the pandemic has affected familial relationships in terms of family and domestic violence?
Yes, can anybody hear me now? I'm really sorry, can you hear me?
We can hear you.
Yeah, thank you. Look, I'm really sorry. My system, I think, got tired or something. I've been using it for the last 8-9 months for the campaign, so I don't know what happened to it. But I'm really sorry. Look, I missed the beginning of it, but I understand the topic and the subject. something really got by surprise everybody, including the community. And then there was no cohesion of what actually, how to engage it and explain it. There's obviously definitely a generational gap, and also the younger people who are not politically, not even political, I will not say even information, were not listening and don't even follow mainstream media. And that created a huge information gap, which until today, it seems to be there's a great number of people who are convinced that what has happened was some sort of kind of a political thing. I think we need to understand and really ask ourselves before we talk about everything else and say, was there something called a pandemic, which is putting the whole world into our knees, and Australia, and then Victoria and Melbourne was, and yes, we know the high rises was the start of it, just before stage 4. So if we take that point and say it was an emergency, then we say, then what was the proper process of dealing with that? There's a lot of questions be asked. I was even questioning from the beginning. I was very, I become very emotional when I thought, this was a rush. This wasn't, given enough proper thought. But the more I realized, and especially hindsight now where we are, where the whole of Melbourne was locked down, the more I appreciate it and say, well, it was an emergency. And even if we forgot everything else, the people who were making the decision were absolutely convinced there was the virus has taken root, and the best way of engaging, of dealing with the situation is to shut it down, and for 5 days. And that is what happened. So I think we need to ask ourselves, and I think instead of the Africans, people who are more prominent, we're not only us, not there. Even not African, East Africans, they're not there. There is a lot of other Africans, but other communities. So before we just said it was might be a target, it might be not well thought, we should actually add one-on-one together and ask these basic questions and say, what was the alternative? I gave an example once when I was talking to people. If there was a fire in the building and the fire brigade was called, and they knocked the door, would you expect them to politely knock the door and say, look, we think there is a fire, you might be in danger, can you come out? Or would you expect them to smash the door if there is a fire and rescue the people? I think we would have criticized them if they don't do that. And that's what happened. So let's just say it and look at it back and say, what was the thing? What the people who were making the decision said was, the virus has taken root in these high rises. The families were very interconnected. They could not easily, comfortably trace it. And the best way of doing was shutting down. And that's what they did. So if we think there was no virus and they could have flowed it easily, and therefore the shutdown was not necessary, well, I think let's discuss that and say, to me, that is where I see it. And I always see it comes back, and people are getting the sense that they might be somehow targeted. Is whole of Melbourne targeted now? Is shut down? Is the businesses who are completely shut down targeted? That is where my position is. In terms of the family violence, and that, yeah, certainly when people are locked it and the space was less, it is definitely there. But I will say this community are in a sense better positioned than the other communities. At least they were not isolated from the beginning. There's a lot of people talking about crowded, too many children, 3, 5, 6 children in the house. One thing you will get from that is people are not feeling isolated. They might be given, overcrowded, all of that thing, but they are not isolated. So, when you have something, you can put your frustration, have a bit of fight with your friend or your sister, whatever, you are in a much better position than when you kind of, take in everything and you're isolated. You hear sometimes people who said there is a people who didn't speak to one human being for a couple of months. These people are not in that situation. So certainly there is the potential that to happen, and we know certain issues happen. But in terms of the wider community, I don't believe we are in a worse position what the COVID-19 has brought. That's my assessment of the situation.
Thank you, Hamdi. We do appreciate both diverse and divergent views. So if you thought that the government did the right thing, then you're entitled to it. I feel like a lot of people may agree or disagree with that. And there were a lot of alternatives on how it could have been done better, just like the rest of the community, giving even a 24-hour notice. This is me, I'm not a panel member. I'm just supposed to be a moderator here, but I have opinions. You know, like giving some time at least so that they can go shopping and things like that. But I do agree that if there is an emergency, then yeah, we should be jumping straight on it. So maybe that was the right thing to do. We'll see what everyone else has to say about that. Do we have Al-Hadi here? Sorry, I just didn't see him.
No, he
on.
had a problem, a technical issue.
No problems, no problem. So we'll just,
Yeah, apologies.
all good. So we'll move on. How has the pandemic affected young people in terms of education? And I know the hard lockdowns didn't allow for people to go to school or to work. So how has it affected young people from face-to-face to online learning? And how has it affected the pandemic and how we see education now? Ring, do you want to start us off?
Again, I have to admit myself. Again, okay. Thank you very much. This is a topic of importance and for me. But before I answer that questions, I would like to say a warm-hearted thanks here to our community members who are locked in those tall buildings. And look, yes, we can all have different opinions and all that, and it's not about going back and forth or anything. But we are a neat community in a sense that our togetherness during this pandemic become an issue. And the issue would have been really, would have been dealt better, like what you said, AD. And AD, I need to also make an announcement here. AD, she's somebody who was there from the get-go, and we were all volunteering delivering food in those towers. And what we have seen, people who live there, they're like any other ordinary Victorians. They are all law-abiding citizens. You do not need to have a police contingent, and you do not need to remind us where we came from, where actually uniform means something else to many people in those towers. The whole thing would have been dealt with it better. We just need more social workers. We need more psychologists. We need more medical personnel that would do the testing. We need more people from the DHS. That's what we needed. And I believe even when people talked in the community and when the community converged online, we all heeded all these messages and the testing was done and everything ran really smoothly. That's the way I look at it. Look, young people are the hardest hit. Let us be honest about this. Because now there's social networking and the way that situation, socializing is very important. It helps you grow, it helps you transition, it helps you knowing who you are, and it really shapes your identity. And that's have been ripped away from a lot of young people. Now, it's not about schooling. And I hear this most of the time, it's like, yep, give them laptops and they will learn and they'll be brilliant. No, I mean, you're talking to these young people as if they were robots. They're not robots. And we are all young, I mean, before we grow older. And you know how sweet it is and how beautiful it is being a young person. Everything is sweet in your mouth and everything is beautiful in your eyes and everything is good for you before you start to learn in many different ways. So basically, I see the impact is not only about the schooling, and a lot of people talk about the schooling, and I'm not saying the schooling isn't really important, but their social aspect, their growth, right? Their employment, their future, their identity, particularly from the cult communities are the hardest hit. Most of these cult communities, they are social communities. They have to congregate, they have to feast together, they have to celebrate together. They need to worship together. They need to go and visit a loved one who is sick. They need to visit an uncle. They need to visit their auntie. They need to visit all their relatives and their friends. And that has been ripped away. And the impact here, young people now, particularly my community, the South Sudanese community and Terra Islanders, we top the list of the people who copped it real hard. So basically, if there's any ways of raising money out of this COVID-19, that will be through the most impoverished communities. The South Sudanese community and Torres Strait Islanders are the one paying heavy price. Majority of us, we're not saying like our young people aren't really law abiding, but there's a line there where actually we stand out, we look different. And I can tell you this, I worked as a compliant officer, and I was working one of the hotels in the city. And I was standing on the line of my colleagues that were going in to check in to work. And I was singled out the fact that, why I was standing on the line and things like that. And I thought it was just a friendly talk. And before I knew it, I was asked about my ID. I mean, you could see that. So I'm a grown up man. If that happens to me, what about a young person that actually could tower them and you look at them as if they were villains? So look, young people, they got a long way to go, and particularly young people from my community, definitely the one that who are coping even worst of anything that COVID-19 have thrown at us. Young people in our communities, in the cult communities, they were at the back foot in the schools, in terms of literacy and learning and writing and readings. And now they've been locked away, they've been stashed away. A majority of them, their parents might not be that really well versed in English or even known how to tutor their kids. And I would like to acknowledge here the great work that AD does as well. The fact that she's a mentor, she's a leading mentor program at the Brisbane City Council, the council that I'm standing for these elections in the Grassland Ward. And also she works in she's an educator as well in Milton, as she was introduced earlier. So the challenge is really quite huge, and I believe AD had a taste of that. Thank you.
Thank you so much, Ring. Yeah, a lot of the young kids, the African kids, have said that they've really been struggling with online learning just because of that communication barrier between themselves and the teachers. A lot of people say that they feel like they have to teach themselves now and they're learning everything on their own. And also, yeah, being at home with parents who may have not gone to school or a whole bunch of kids in one home, sharing devices has been really difficult as well. So thank you for that. Yassine, do you want to talk to us about the employment pool and how COVID-19 has changed that, and what we can do to best support the community now coming out of COVID, or we're still in it, but once we do come out of it? You're on mute. Unmute yourself.
Yasin.
Yassine, you're on mute.
I think Yasin. I want to ask
There we go.
something in the young for the young.
Oh, sorry. Yes.
Because
Go
the
for
young,
it, Yadata.
For example, because some family they have the kid is like 16 years, 17 years, the year 11, 12, because when the 2 hours walk outside working, come back, some kids they never come back on time because like wasting like 3-4 hours. Some family that call us as the community leader, because when the kid is out like 17, I've a right to go out when they say, because all the community leader, we call each other, because when the kid is going out, because the families has to work with them, because when one person miss like 5-6 hours in the after midnight, it's no good for the safety. Because more they have to because when they become more stressed, the kid is just one person, he's standing himself outside, because we follow the family, we explain all the community member, because that big issue, the mental problem. Some family that ask the kids what's up the problem, because I'm really confused, I don't know what to do, because it's still the young generation under 18, they need to strongly support. It's really important, that area.
Thank you for that, Yadata. I'll pass it back to Yassine to answer the question about employment and what it's looking like now during COVID, and what we can do to support the community once COVID is over.
A little bit, I will mention what my colleague Ring said regarding the youth, what is happening for the education, and then I will jump to the employment. Because as I am talking now, exactly what's the picture, the mirror, what's happening that time, at that particular time, at that particular area, that's what I'm saying. So regarding the youth and the education, what's happening is, after the second day, we as a leader, for example, for residents in my community, we did about 2-3 WhatsApp group to communicate with them, so to ask what they need, and then we can supply them. So a few of them, especially the youth, when we do the WhatsApp, we don't want to hear you. You are with the government, you are with the police, you never listen to us, you don't care about us. All of them, mentally, they were sick and they're ill. And then I say, why? Slow, a little bit, because we don't have any information what's happening. There's a government to do all the homework and they did themselves. They said, for example, one of the lady told me, since the school start, I was working hard to become a pharmacist. Studied day and night. I didn't help my mom with nothing at all at home, because she told me, study and I study. Now I broke everything. That's it. All my dream is gone. For a week, I have to lock up myself. That's it. And then she keep knocking the window. We can hear it from downstairs. Knock the window. You hear me? I'm knocking the window. I don't care. Let the window is broken. So a lot of frustration is happening. That was regarding to the education and the youth. So when I come to the employment, for the employment, I don't know if you understand, or the official statistics say 55% of that area for the youth is unemployed, which is in overall Australia, this is statistics, in overall Australia, nearly about we're talking about 5-6% employment. And that particular area is 55. That's 55, very positive. From what we see as community leaders, from what we see, from what we see them, we talk to them, we do program for them, there are more than 60 to 65 unemployed. There's nothing to do. To tell you honest, there is a Flemington Community Center there, North Melbourne Footy Club there, North Melbourne Community Center is there, and I know more than 10 to 15 government body working in that area. There is no one African person is working there. There is no one. Only in Flemington Community Center, which is 5 towers there, for more than 1,500 people, Africans living there. There's only 3 of them. One of them work one day, the other one work half day, the other one only work at the community center. Is the community center occupied to do a wedding or community functions? That's all. So why the government they didn't give this opportunity for all? But why I'm talking now is the fact what's happening in that area. What we all this we get it up after COVID-19. After COVID-19, the governments come to us. They invite us. To tell you honest, since 4th of July till now, with the HSS and other 10-15 government bodies, we do a meeting twice a week. We just last week, a week before we finish, we do once a week. We have a meeting from 7 to 8:30. Why? We do briefing, what's happening there. They bring it to us, we discuss it. Education, health, mentally, and everything. So what I'm saying now at the end, all the governments now come down and they're asking how we can help. What can we do? Now we know minister is there, he can't do anything. A minister, a labor minister, doesn't matter labor or green, whatever, I don't care, but is a minister there, he can't do anything. If you come to the education, the 2-3 education is there, they do nothing to them. So the number of the students come down every year. So the employment, like we say, services, there is no day. For example, we do Eid festival there. Eid festival means the Muslim yearly Eid. We call all the people living there, even the Muslim and Christian together. We do some celebration for the kids. They never fund. When we ask for fund, we ask for just 5,000. They give us $200 or $250. That's it. Now all the governments come in asking, what can we do for you? What can we do for you? But all the people now understand and people all become aware. So that's why now we're working hard with the government body to get solution.
Thank you so much, Yassine. Hamdi, how do you think we can best support the community moving forwards in terms of employment?
First of all, I would like to go back a little bit, one step back. What we need to ignore it is there was absolutely a significant disconnection with the community when the lockdown happened, and that is the biggest issue. As I said it, my views are very clear. I don't have a lot of issues of the steps being taken. I don't want to second guess the professionals. It's not even the government has made that decision. We know chief health officer made that decision, and the government has to follow it. But one thing we need, unless we address it, we will never address it is what has brought us where we were, that the government wanted to do something significant to this community, and they did not have any way into it. That was happening in the last 15 years or 10 years. And I talked about so many times. One of the things Yasin is mentioned, it is true. For God Even Community Center, there is an office for DHS which manages each couple of towers. There's no one single person being employed in the last 20 years from the community which was most visible. So when we see the community shocked and thought they're being targeted, although I believe they were not targeted, the reason behind it is because there was no connection. And one of the things I also learned in engaging with the department and the community in the last 10, 15 years is the lack of sympathy. When the community is unaware of it, what has been done for them, and they do not know whether they are missing an entitlement or they've been given even more extra, there is no proper communication and there is no sympathy. So for example, if an officer genuinely tells them you are not entitled to this, they still might suspect it that there's something, they haven't been told the right thing. But if someone from the community works in there, they will get the proper information, the proper advice, and say, look, genuinely, without being, telling them to go visit something, they will say, look, you're not actually entitled to that, or no one is getting that, and they will get it. So what I'm emphasizing is we need to understand, I don't believe the issue was the lockdown. The issue was lack of connection. And I blame that issue first and foremost the federal government. When this community started coming to Australia 20, 25 years ago, there meant to be a settlement program which was happening in other communities where they track everybody where they going, and even the state government will get a briefing of how many people from which area they're coming, and the funded be organized, and they should get a job, in the community where they land. And today, after 20 years, there should be people who've gone through the stages of settlement, community work, and have experience and developed it. It was a complete shutdown. So the community hasn't developed any skill of engaging the system. And now we all of a sudden, when something major happens and the community says, what is happening? Why are you coming to us? We're shocked and we're saying it, why is this happening? And I really feel but we have to blame what has happened before that. And most of the blame will happen with the federal government. That is a fact. I even remember the time people who come from other areas like New Zealand, where the state government, DHS, did not know how to deal with it. I remember the time people, when they come, with a residency, they used to get visa and this kind of things. They learned it years after. There is some sort of entitlement. These people have a particular visa, and they started questioning them and asking them to fill a form. That tells you there's a huge people will come brought by the federal government, and they just come to the service of the state government without having any briefing or any knowledge or any information being given to them, and they have to deal it by face value, whether it's education, whether it's housing, and whether it's health, anything, all of that. So that is the issue and need to be changed now. And the first thing need to be done is every service which are being provided mostly to this community, them to be visible very clearly, other service provisioning. That is what can be done. All the other things to me is just a talk, and we go back to where we were, a year ago.
Thank you, Hamdi. And you're totally right. Seeing community members of your own kind in those kinds of jobs does kind of generate some sort of, I don't know, cultural competence, both in the job and, that kind of rapport that you wouldn't get talking to someone who doesn't know your cultural background or how to deal with it. So thank you for that. And I know a lot of us Africans are heavily involved with our religious groups and things like that. And, with churches being closed down, events like Ramadan not being able to be held because of large groups of people. How has the lockdown impacted cultural days, and how is the community trying to adapt? Who would like to answer that one? I think I will throw it to Yedata. Yedata, can you hear us?
Yes.
So how has the community tried to adapt to, religious
Yeah, it's really important for
Religion.
the religious for the community. You know, the religious group in the community leader is really important. The effect in the lockdown, all the cultural day to during the pandemic, because everyone's really confusing to supporting the cultural system, because the most of our people, because we try to organize to listen follow the Australian, because the government follow the media, because when the government are talking on the media, because even some people they don't know about the information, we have to translate to explain to them. It's really because it's still the people that want some religious people that want like Friday, they want to come together. For example, because long time, even when the Ramadan is coming, they used to the young kids come together, sit down outside, because we used to work with the Flemington police, working, like community safety around the patrolling. Is really important to listen the community, to understand each community member, because the person is from North Melbourne in Flemington is really good people sharing information before. Now, because most of the young kids they're scared about the police, they ask us. It's really because really confusing to become together. The community member is normally when the young kids run out from the family, the drug addict, the alcohol, everything. We try to explain with the sheikh, with the community leader to support them. Some kids when the family very hard to handle, we try to explain slowly to take them the mosque. Because when some people, when the police catch them to take some kids that drug addicted, that take them to rehabilitation for drug addicted. Some kids that run from the rehabilitation. And then I call them midnight, to Yasin, how to solve the issue, because when they run out, because we have to call the police to solve the issue between the family and the police, and then young person that has to put back to the police hand, and then they try to solve the issue. It's really because when something we try to, as a community leader from the cultural background, they try to solve the issues themselves. It's not that, because we have to merge with the Australian system. It's really important. Always handling the cultural background to solve the issue is really hard. Some people that have the mental issue, very hard to straight away the crossing when the cars, everyone driving, they try to run to the car. That kind of thing, because we have to solve the issue with the Australian system to take them to the hospital, to explain to the doctor, to solve that issue. It's really important. Religious person is a good time when the Ramadan is coming. Like Imam explained to the youth, they stop to drinking, using the drug. Only the night time is the quiet time when the Ramadan is coming. After that, sorry, because this time is still we need to support as a community leader with the Imam, because we need a couple of the Imam community leader to join the family relationship, get training. That's really important. Because family relationship to organize, to solve the issue between the court with the family, we have to know the Australian system to solve that issue, because it's really important that area, Dr. Birhan, because better to organize for us, to a couple of people from different community, how to solve this issue. When when the police put the intervention order, some people that try to solve the issue, the cultural system, because we have to focus about the intervention order. That's really important to solve in the religious person, community leader, better to come together, solving the issue, and then the people, the young generation, the people that growing up, the well education to adapt the Australian system, how to sharing the information to solve the issue is really important. That area.
Thank you, Yadata. And I'm gonna pick up one of the questions that was put on the chat from Kim. And what services have been most helpful to community leaders? That kind of falls off the back of, you saying imams had the unique opportunity to actually spread awareness to people. So what other services have been most helpful to community leaders? And I will pass this to Yasin Musa if you'd like to answer. You're on mute. Yeah.
Yeah. Thank you for the question. Well, first of all, that was arguing for what's happening in the COVID-19 in the lockup towers. The government always, there's a community leaders. The community leaders themselves, they work voluntarily, helping the new refugees coming to the area, mothers with no husband, what they need. So that the community role is. Come in, please. This is Centrelink. This is bank. You open bank account for the kid. This is school. This is that. So the government have to sit with that community leaders. They must address what your issue, how we can solve your issue. If we help your issue, the problem in the background will be good. That's only the people they need from the government. And 3-4 programs over the year helping the community. We have to sit down together and identify that one and put tick for that. And the government easy can work. So we're arguing now with the government as that locked up area. Why they don't tell us? For example, in the morning when we come there, when we have a look, we saw about 2 containers full of food, about 300, 500 people, volunteers, those different people with uniform. They never talk with anybody, only with their bosses. But their duty to take the boxes, to take it to the towers. That's all. The government, they done very, very good homework in the background, but they didn't come and talk to the community leaders or anyone can help them to help what they can do. So this is, they have to sit together and do identify what the problem is so it can solve. If they need the youth, we can bring the youth, sit together. If they need the mothers without husband, there's a lot of trauma going on there. So those ones, let them come down, sit, they can solve the problem. That's what I think.
Thank you, Yassine. Yeah, and we've heard that time and time again, community consultation is the most important thing. You don't just come in trying to work things out for people that you don't know you're not a part of. So community consultation is a huge one, and it was lacking during the hard lockdowns, as we saw. And what early intervention programs have been most successful, or maybe that needs more improvement in engaging African young people and children, and we can even throw it out to just Africans in general. Ring, do you want to answer this one?
Oh my goodness, that's a very tough one. Because the reason I'm saying this is because I haven't seen any intervention now we could literally be proud of and say, look, we intervened and we stopped it all together. Although I differ a little bit with my colleagues who spoke earlier, the candidate Hamdi, he said, and I hope I'm quoting him correctly here, the decision that was made to lock down the towers was a correct one. He stand by it. It sounds like if the towers were the epicenter for the second wave that had really engulfed Victoria, which is not true. People who were infected in those towers, if you compare them to the people who were actually led to the second wave that led to the lockdown in Victoria, that emanated from rich hotels, and that's the hotel quarantine bungalows that need to be blamed for that. So I just want to clarify this one clearly. We as immigrant community or cult community, we were not the source of the COVID-19, nor have we misbehaved in this extent that the wave later on will spike because of the immigrants. That's not true, and I believe that was just a kind of a whitewash here. As for the intervention, I believe the things that had really worked in the end, but not an absolute one, and it was late interventions, is when the DHS and the governments and other organizations worked hand in hand with leaders within the towers and also the cult community leaders. A good example would be the prominent leaders whom have really liaised between the government and the community leaders in those towers and elsewhere is none other than Dr. Burhan himself, and he's highly commended for that great work he has done. And many of my colleagues who were there first time from the get-go, they were there. UNI AD and Izzadin and others, and also we do have John Mashar as well was there. These young people, they did a great work, and I believe there was another young lady as well from the Ethiopian community was there from the get-go, and they were amazing. A lot of young people who came out and did a good work. That was a great intervention because these young people, they weren't just there standing doing nothing. They were communicating with a lot of young people who were actually having mental breakdown, and they were telling them, look, we are here with you guys. And you could see through the window. And they were able to change messages. They were able to change communication. And that had really calmed down a lot of young people, who didn't really understand why they were locked in those buildings. So basically, if there's any intervention that will work for all of us, most of the time, it comes down to the consultation. And the reason I'm saying this, COVID-19 have really highlighted how much, and I really don't want to spin it here, how much barriers that exist between communities and the government, whether it is the local government or even the state government or even the federal government. I'm not quite sure if that applies to all other communities, but the experience that we had in those tall buildings had really highlighted even those decisions that are always made. They are made actually blindly. That's the way I look at it. Because if you don't know the root causes or the issue itself that you would like to intervene and resolve, and actually you just chuck money at it, or you just throw billions of dollars food out there, a lot of these things was all wastages, excessives and all wastages. And I wouldn't say that is a wrong intervention, but the way it was done and the way the government intervened, not entirely wrong, right? But it would have been really improved better if the government would have liaised with the grassroots leaders and people that actually who are well known in the community and also in the government sector and private sector, somebody like Dr. Burhan and other prominent individuals who are with us here in this forum tonight. Things would have been really better. So far, we're not out of the wood, and I'm not going to paint a bleak picture here, but we are in the murky water right now. I don't see anything that's working at the moment, not entirely, but I don't see something that is working that to resolve the issue. Until now, we don't know how the future will look like. Until now, we have no idea. Thank you.
Thank you, Ring. And that question came from Jasmine. Sorry, yeah, you can answer.
No, not the question. I'd like to say something. I think it's very, very important. Brother Ring, you could have asked me a question, but you made an assumption which is wrong, that I kind of said it, that the African community or the Kal community was the reason for the forward. No, I did not say that. What I said was the sign, it was a symptom of what was coming to Melbourne. So we are part of Melbourne. So what I said was, if that looked a bit unusual, we know what happened to whole of Melbourne now. In other words, there was something coming for Melbourne, and that's what happened. But what I will say, this is what information I was told. I'm someone who's very connected to the government because I've been active and working with the department for the last 12 years. This is the information I was told, and I was even given a hard data. When a breakdown happened in Al-Taqwa, first of all, let me go back one step. One of the information we've been given is 70 kids going from North Melbourne and Flemington were going to Al-Taqwa. 69 kids were going also to another school, which is on Bermuda, that area. We know Al-Taqwa had the biggest cluster until I think maybe even, varied. I don't know, even still might be the biggest something. Now, when the tracers traced it and found out there was 70 kids going to that school, and then they found a number of the families were attending them and they were positive. And then the second step they have taken was to trace. And what do you need a tracing? When you need a trace, you need to say this family, someone is positive, had a contact with this other family. And when you have them, that's intertwined. And also you have to understand, we take into account something positive later on becomes for this situation negative, which is the community is very well connected. Because some people put a comparison and said, if they discover someone with positive on one of the high-rise in the city, they would not shut down the whole tower. Yes, the reason is you can easily say people who live in these towers have no relation with each other. You know how Australia lives. You see neighbors who next door to each other have never even said hi to each other. But this community, they are families, interconnected. You could easily, if you ask one family, they could tell you, I have visited every tower of someone from that family. So that was the reality of what they have faced. And also you have to realize they are at the same time thinking, if we wait tomorrow, could this spread spread and infected the older people. Not even, we know the young people is not the issue for it. So that was the situation, and that is what I'm talking about. Not, I did not say it was the EB center came from here, but that is a cluster. That is the fact. Well, also the other information we were told also, which collaborated by the community, is people very early who were positive, who were told to stay home, did not stay home. That's the other factor we get from the community. The community is telling us, and sometimes the younger people, and this is the fact of it, and it gets me frustrated. The younger people don't get all the information. Older generation got far more better information. For example, who say to you and say, yeah, so and so become positive. They were told to stay home, but some people even left from at home and went to the restaurants, and they even look. I don't want to go too far to it. Some people saw this thing as not only unique to us, as other people also. You see even leaders, leaders of the world, most powerful people, see this thing as being still hoax. And that situation is everywhere. So that is the situation what they were trying to deal with it. It was not something they just woke up one morning and said, let's lock down these people, they might be a problem. I don't believe that was the situation.
Thank you, Hamdi, for clarifying. And that also leads to the next question that was from Abdikani, which is how can we improve community awareness during this pandemic? Like you said, Hamdi, that there's a lot of people that are misinformed or still broke the rule or just didn't fully understand what was going on. Yassine, do you want to answer this one? Oh, just unmute yourself. Yassine, can you hear us?
Can't mute myself. Yeah, the system doesn't work for me. I'm okay now. Yeah, thank you, Abdul Kani. Well, exactly the question. I should turn it to the other side. The way we did was successful. I didn't go with you all the stage, but if I talk to you all, maybe it's going to take me 2 days. But what we did is, Abdul Ghani, for 3 group, we do WhatsApp group for the my community, which is about 110 of them, 115. So this is the best way you can handle it. For example, the youth, regarding to the ages, do for them one WhatsApp, do one leader. Let them be the mothers, especially the mothers. Why I say the mothers? Because the mothers, they are a basic family in our community, in the house. If you get the mother, you get the youth, you got the kids, you got the husband. So do one WhatsApp for the mothers. Give them some proper person, talk their language to explain to them what the COVID-19 is. And then the oldie, my age, do for them one WhatsApp, do for them someone to talk to them according to their language. Don't bring for them someone Anglo-Saxon, for example, the same like Flemington Community Center in Flemington, more than 1,500 people, Africans living there, and all Anglo-Saxon. What I'm saying, they're very good people, but brought for them someone from their community to communicate with them, pass the information very easy. At the end of the day, we need for the benefit of our community. We have to pass the message properly. What's happening here now? Minister comes sometime. The minister comes and said, oh, for this area, for the youth and the employment, we put $22 million for that area. And then we as community leaders at grassroots level, at the end of the financial year, we get only one sausage. We do barbecue for the family. We tell them about the government, what's happening. And then we get the sausage. That's it. All the funds finished. Where is the 22 million? Going to the office, the officer, the computers, the blah, 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 and the report. At the end of the day, the community get one sausage only. So, Abdulkani, thank you for the question. This is the best way you can tackle the information. And this way, you get to the youth, to the mothers, to the fathers as well as. Thank you.
Thank you, Yassine. That's a great idea. Yedata, did you want to add anything to that question, or should we move on? Is he? Okay. I will pass the next question to Hamdi. What are the needs of the community? What still needs to be done at this moment so that we're better prepared for the future?
Well, look, I think better engagement is, and I am not being too negative when I say, we talk about, engaging. And for example, when I said people local to be employed, I'm not being just opportunistic for them to get a job. It is more how to, what we call it, you get biggest, whatever for your buck, or maximize the value. If, for example, someone works in the local office, when someone who doesn't speak the language very well comes in, instead of calling a interpreter, which also might not interpret it properly, and then wait a couple of hours and all of that, you could easily solve the problem by having someone from the community working there. Second thing is, one of the things I really learned it is the information will filter to the community a lot easier than if you do have the most beautiful process or have the biggest community meeting. All of that will not mean much. You would solve all of that problem if one person from the community works in there by telling them what is expected, what is happening, what is not okay. They will get the information. And even if sometimes people will call, for example, now one of the two girls from the East African community are one of the liaisons. I engaged one of her. People are telling each other. So the mothers will come and tell and say, look, I heard your name, I have this issue. And then she will explain to them very clearly what is possible, can be done and what cannot be done, and then pass her information further up. So the relationship and the sympathy to each other builds up and becomes a lot cohesive. So to me, that is the most significant of it. I don't really want to make it that we are too selfish and too opportunistic. I'm not saying it, don't employ someone else. I'm not being. We welcome to this country without almost having nothing whatsoever. That is a fact, and we have pretty much everything. So I don't want to say it, keep it to ourselves and no one else should be working for us. I'm just saying it, how can we maximize the best value of what is happening, what the government is providing to this community, instead of going in a long journey, in a long road to get the same outcome. So more consultation, targeting. Yes, one of the things, if I may please, one of the things I appreciate Australia a lot is you are seen with the moment you put your food in Australia as part of the mainstream Australia. So in one sense, it's a disadvantage that you are just being plugged into there. But on the other hand, it is an advantage of it is like you are equal as everybody else. You could stand before office, you could do whatever. So when you suffer, but on the other hand, everybody expects you're not being seen as a refugee, you're not being seen as something, officially. So that is a fact. And I know agencies sometimes faced with that problem when they're trying to, employment and not to be focusing too much into the community. But I think it's worthwhile the government higher up to target and say, for example, these services are being provided to this community. How can we maximize the value and say, in not too publicly maybe, how at least one person, two people from this community should be always working here to maximize the information flow. That's what I would suggest and will work, I believe, the best for
Thank
the
you so much.
and the community.
Thank you. So we are very conscious of time. So I'm going to skip to our closing statements, just so that we can do a few things at the last few minutes. Ring Mayar, in 30 seconds to a minute, what is your closing statement?
Well, first of all, I would like to thank all the audience and the officials who are here with us tonight. What I would like to say is the fact that us as a cult community, when it comes to major issues, we would like to be treated fairly, but also if the laws are out there, we need the laws have to apply to all of us. You can't have some laws to some particular people who happens to live in those towers. These towers are beautiful places, they're wonderful places, and people who are there are great people, and we need to respect them and give them their dignity. And they are Australians and they are taxpayers. Nobody's an indulger. Yes, some of them who are struggling are there, but most of the young people that I've spoken to, they're all working and they're all taxpayers. They deserve better. They deserve respect, and they deserve to be treated as Australians, as my colleagues have said earlier. I would agree 100% with Hamdi as well, what he said about community engagement and community collaboration with the government and all other service providers, as well as universities and all these kind of stuff. Look, I've been advocating for Canadian model for the last 2 years since the time I became a community leader. If we look at the Canadian model, it's working perfectly for Indigenous and the new migrants who immigrated to Canada. And they were able to generate their own employment. They were able to support their young people to go to schools, and they integrated very well. And I would encourage each one of us, all of us here, to see the Canadian models for the most of the refugees and Indigenous people. And to conclude, to be honest, we do not need to be, our communities, we should not be made as a subject where actually crumbs are thrown at us. When I say crumbs, it's just a few dollars here and there, and you think you're doing something. That's what I call a whitewashing or glossing. We do not want that. We want a real engagement. And if there's any money there's any investment need to be put for the coast communities, it has to be a real investment. It cannot be concentrated on only a few hands, and later on we don't see anything out of it. And there's a lot of examples I can give. There's a lot of money being thrown around, and communities such as South Sudanese community, and I'm not going to delve to it because I need to close up. We deal with a lot of issues. And I'm not just saying this to only my community only. The Somalis have dealt with it, the Vietnamese have dealt with it, and all other immigrants who came to Australia have dealt with it. But should we follow the same path? We have to struggle like the way everybody else have struggled? No, we shouldn't. We should not. Australia should have learned from that, and it has to bounce out of that. We live in a global world, a multicultural world, well connected, and nobody lives alone. You don't have a suburb that is only predominantly Africans or Asians or white people. We all have to integrate. So we need to learn to integrate. I believe in integration fusion, where actually we all mix together. Multiculturalism, yes, is beautiful, but we need to integrate. We need to work together. And I can't say it better than what my friend have said. And thank you very much. My friend Elia Musa have said this last time. We need the community that work together and actually do everything together. So thank you very much for listening to me.
Thanks a lot. That was a lot more than 30 seconds to a minute. But thank you. Yassine, the floor is yours.
Okay, thank you, my man. Oh, well, for me, I want pass the message to the government body. If anyone from the service providers here, measure the fund coming from the government, what the money being spent at the grassroots level. That one I want to know. That one the government measure the money spent at the grassroots and don't go all the way up. Don't go from up to down. That way, I'm saying is not getting them. That way, the message is not getting to the grassroots level. Thank you.
Thank you so much. Yedata, what is your closing statement in 30 seconds to a minute?
Yeah, thank you very much. Because I really appreciate the government to listen to us. For the future, because everyone better to someone respond in the community representative, to sharing the information, to report through the government. It's really important because relationship between the community and the government, multicultural level, it's really important to information, because as a community leader, because we try to organize the relationship between the immigration, AMS, Department of the employment area, Department of the housing, because when a lot of people because they don't have the young kids, when they run out from the family, we try to organize accommodation. It's really important to someone listen to the community leader to support the future, to change the issue for the system for the new migrant, because when the people come from the overseas to live in here to join the Australian system, they have to be it has to be focused like his hometown, because still when the issues not solving the issue, because the people come still thinking about the back home, it's not good, because we live in here for long life, sharing information to join the system is really important, to continue to listen to the community leader. Everything is really important to listen to us, sit down, share information. I'm really happy to sharing all the government body, because the pandemic system, the building the system, I never see the most of the government body listen to sit down the community leader the first time when pandemic happened to that we sit down, share information, and then to solve the issue, the community leader, with all community members, really important to, because step by step to understand each other. It's really good to continue in the future to listen to each other.
Thank you so much, Idata. You're totally right. Community consultation all the way. That seems to be the main reoccurring, piece of information that we keep giving. Hamdi, last but not least, what's your closing statement?
All I would like to say is the fact of the matter is sometimes, in an ideal world, we would like things to be different, but we have to be, perspective or relative of what the situation is. We are this country, we've been welcomed. We got, as I said it earlier, without almost most of our people, I would say, without having anything, we have now a lot. And if we engage with the system and go for it, I believe we could do a lot. I would like just to give you one example relating to me, is people mentioned that I'm a candidate. When, and this is before COVID-19 happened, it was on late last year. I was asked, in order to nominate, I have to get the signature of 10 people who live locally. There was only one person, African, who signed that. All the other people were Australian. People we normally consider, say, Aussies. And I did not have any relationship with them. That is a fact, any other relationship with them. There's 3 of us in there representing Labour, and none of them. I even was able to say, no, unless we have an election, I will not be number 3. Where else you can get that sort of things? If this one was in my own country, which I adopted, and I'm able to fight for it and get that. We have to be real. I really don't think we can expect things to be done for us. We have to fight for it politely, respectfully, and using the system. We are in Australia. We've been welcomed it. I'm a little bit get sick of it, really. I think we're focusing too much on the negative. Let's go for it. And if someone is using against the system, something, whatever, well, point it out. I will finish with that. Thank you.
Thank you so much. And that's 8 o'clock on the dot. So we did well. We did well. We had a survey that was conducted by Africause. If Tara wants to quickly go through that, just to show everybody, and then we'll call it a night. All right. Tyra, do you want to explain the survey?
Well, yeah. I will just explain really quickly. It's basically what community leaders have already talked about. We have done this survey with people from the community, from different ages, as you can see. And the most important things we found is that the job situation at the moment, most of them are unemployed, and they have been unemployed for 6 months to 1 year or more than 1 year. So basically over 60% has been unemployed for a long time. Another thing that we have found in this survey is that, as some of community leaders have mentioned, is that there is a very low feeling of connection with family and community during the lockdown, especially, and we think this will continue for a long time. They feel very low connected, and especially to family and community. Another thing that was worrying, and that has been very important for participants, is the income. They are highly worried about income, about stability. So more than 60% of our participants felt highly worried about their income situation and financial stability. More than 80% have felt that COVID has been highly disruptive for their lives, not just in this moment. They are considering this year as a breakdown disruption for the future. And the most impacted areas that they have mentioned is mental health, relation with family and friends, cultural and religious engagement, and work. So financial stability and studies. I think these are some codes that we took from survey participants. We haven't put any name here, but they someone said staying home with kids in a very small flat for 24/7. It's very challenging and stressful. This has put immense pressure on everyone. People are starting to lose their minds. Anxiety is being expressed in all sorts of places, but not being fully acknowledged. So I think, well, we want to close with this as a reflection of what community is thinking, what community needs, and what still needs to be done.
Thank you, Tyra, for that. And I think we will have the opportunity to distribute the survey to whoever that wants it, or to all of our email lists. Is that correct?
Yeah, we will.
Yeah.
Beautiful.
Yes, we will.
I just wanted to say thank you to everyone who joined us tonight to listen in, and who asked questions and who contributed. Thank you guys so much. This was a very important conversation that we needed to have. And I want to thank Dr. Burhan Ahmed for Africause and for the think tanks that he always has, and for the platforms that you always provide for us to come together as a community to talk about some serious issues. So thank you.
Yeah, just can you mention we are also planning for women's participation and a separate forum. Would you mind highlighting?
Yes. So towards the end of this month, we haven't locked in a date yet, but we will have a women's panel also talking about their experiences with COVID-19 and how it's impacted them, not just in the flats, but in general. So keep an eye out for that. We should have a flyer going around soon in the next week or so.
Thank you,
Any
everyone.
feedback would be great. Please ask them for any feedbacks so that will help us in the future.
Sure.
You asked it already. Everyone can hear you, Dr. Burhan.
We need that so that we make it better for next time. If we made any mistakes now, we need to learn and improve for next one. Thank you.
Perfect.
Yes,
Thank
including
you.
whether you guys would like a different moderator, but I had a good time.
I like to thank you both for doing excellent work, Eddie. As always, that's my expectation, and you overdone it. Now you did well. And Tara, the summary was excellent. Well done. And really, you made that summary look like everyone to understand it in a very simple words. So well done. And we'll share those information, and we'll cooperate for the organizations, universities that are trying to do some research on this area. We'll do our best to help them, and we'll do our best to share our connections and supports to make those research at least come on record and get those findings to influence policy of governments. Thank you.
Thank you.
Thank you, everyone.
The forum has been recorded, so I will send the link to anyone who wants to access to the recording and to the material of this forum. Thank you.
Is Fatia there, please? Fatia, is she there? Fatia, are you there? Najma?